Hi, it's Dr. Eric Balkavich, and we're back for episode 10 of the Peripheral Neuropathy and Diabetes Learning Series. And today we're talking about something that's really important for everybody to understand, and that is nerve damage still occurs when diabetes is managed, okay? So if you're still diabetic or you're taking medications for diabetes to lower hemoglobin A1C and to lower your blood sugar, and you're still consuming a bunch of sugar in your diet, and you're managing that with insulin or meds, there's still damage going on that's causing neuropathy. It really doesn't matter what your hemoglobin A1C is if you're still diabetic. And so oxidative stress and diabetic complications, this is a paper from 2010, and what they talked about in there was there was a study from the Diabetes Control and Complications Trial is what it was called, and they showed that treatment for diabetes and hyperglycemia did decrease blood sugar and hemoglobin levels and decrease the risk of nerve damage by about 11%. But that means there's a whole 89% that while it decreased those values, there's still damage going on. So the remaining 89% of the variation in risk is presumably explained by aspects of glycemia not captured by hemoglobin A1C, is what the paper quoted. So what does that mean? That means that even though the hemoglobin A1C reduces and it's within a managed range, or what some doctors would consider a healthy range for a diabetic, you're still diabetic. And as long as you have high blood sugar, you're forcing sugar into cells, you're consuming more sugar than your body can use or utilize, you're still having damage going on at the cellular level and at the vascular level. We talked about and I'll talk about it again, the endothelial cells and the nerve cells, unfortunately, they consume a lot of, when you have a hyperglycemic state in the blood, that sugar gets into those cells really, really easily. And when that sugar gets into the cells, it increases that polyol pathway. It causes more alcohol production, more reactive oxygen species, and more inflammation. So just because hemoglobin C is managed because of a medication, it doesn't mean that there isn't still too much glucose getting into cells, creating this damage. So just because your doctor tells you you're well managed does not mean that you've stopped the degenerative, inflammatory, neurodegenerative process of diabetes and slowed your diabetic neuropathy. It is still occurring, and that's what this paper, Oxidative Stress and Diabetic Complications 2010, is trying to express. All right?